First at 6, state leaders gave an update on Oregon's fight against COVID-19. Governor Kate Brown today outlined a path to fully reopen the state.
What does fully reopen mean? First of all, no more capacity limits for businesses. Masks will largely no longer be required by the state.
Yeah, the governor has set a threshold, as you may know, of 70% of Oregonians being vaccinated before restrictions are lifted statewide. Just over 66% of Oregonians over the age of 18 have received at least one dose of the COVID-19 vaccine. That means the state needs to vaccinate roughly 127,000 more people to reach that 70% threshold.
The data clearly show that if you are fully vaccinated, you can begin to put the pandemic behind you.
The Oregon Health Authority says COVID cases are falling across the state as more people get vaccinated. The rate of new infections has been falling in Oregon for 5 weeks straight. New cases are currently down 13% compared to the week before. With the governor's announcement about reopening, she also made sure to note that getting to that 70% threshold would be hard work. Fox 12's Simon Gutierrez wanted to know what the state is doing to reach that target and joins us now live with the answers. Simon.
Yeah, compared to the more than 2 million Oregonians who have been vaccinated, that 127,000 number to get to that 70% threshold doesn't sound like a lot, but there are some real challenges and in some cases barriers to vaccination. State models predict that Oregon will reach the 70% vaccination threshold by June 21st. But despite the reasons for optimism, 6 months into the state's vaccination effort, COVID-19 continues to spread.
In that time, a stark picture has emerged. There isn't one pandemic in Oregon, there are two. One is a pandemic that is dying out among people who are vaccinated. And the other is a pandemic that is raging as fiercely as ever among people who are unvaccinated.
According to the health authority, 98% of new COVID-19 cases are in people who are unvaccinated. Unvaccinated Oregonians also make up the overwhelming majority of hospitalizations and deaths.
We've had 98 deaths, unfortunately, in our hospital system. 97 of those were unvaccinated.
With the governor's goal of vaccinating 70% of Oregonians 18 and up, the question is, how do you reach those who want the vaccine but haven't been able to get it?
We know many people who haven't chosen to get vaccinated yet aren't vaccine resistant, just vaccine inconvenient. They have little time outside the demands of family, multiple jobs, or other commitments.
With that in mind, the state is working with pharmacies to extend their hours and partnering with healthcare providers to bring vaccine to workplaces like factories and farms. Those efforts have helped to narrow the vaccination gap between white Oregonians and communities of color.
Over the past week, vaccinations among Latinos and Latinas increased 5%. Vaccinations among Black Oregonians increased 5.4%.
That said, the state's overall vaccination numbers in terms of shots per day have slipped. In the coming weeks, the health authority and its partners will be stepping up efforts for mobile vaccine clinics and community-based vaccination events. And even if the state reaches that 70% threshold, the health authority is quick to point out that doesn't mean that the pandemic is over. COVID-19 will continue to spread among those who have not been vaccinated. I'm Simon Gutierrez, Fox 12 Oregon.